Ask any carer in the country, the last 2 years have been a constant battle to keep COVID away from the elderly and clinically vulnerable. For this care home in Bradford, the fear is abandoning restrictions now risks undoing all their efforts.
That, I think, needs to continue because, again, many outbreaks at this time, but we don't want to put our residents in a situation which is dangerous for their health and well-being.
We've been living with restrictions since March 2020. Months of full lockdown, rules of 6, 2 metres distance, 10 days isolation, working from home, masking and testing. Cases due to Omicron are still higher than at any time in the pandemic. The only reason the government can gamble on abandoning them now is because vaccines, especially boosters, are keeping most of us safe. But what about the announcement to end the need for COVID isolation, possibly sooner than March?
If isolation is stopped, then people who are infected will go on to spread the virus. That is for sure. Our recommendation is for isolation of cases, isolation and clinical care of cases to continue because our goal is to prevent onward spread and also the quarantining of contacts. We support countries in reducing that time. I don't say abandon it, but reducing that time.
I put that to the Health Secretary.
What is the public health justification for ending the requirement to self-isolate if infected? And if the government does bring that forward, is it prepared to do so against the guidance of the WHO during a global pandemic?
It is reasonable to think, just as we're living with flu, for example, we don't require people to legally self-isolate, but to remain cautious, to be sensible. If they're infected, we will I think, eventually have to find a way to live with COVID in a similar fashion.
Perhaps we're in a position to learn to live with it, but what about the rest of the world? One of the architects of the UK government strategy agrees some restrictions can be lifted here, but argues Omicron isn't much milder for countries where vaccines have barely reached.
I think particularly in the UK, we can be cautiously optimistic. I don't think Omicron will be the last variant.
The rest of the world is still in a pretty dire position. You know, numbers are still going up in many parts of the world. And until we resolve that problem in 22, we won't bring the pandemic to a close globally, no.
There is hope, however. It's anticipated there may be 20 billion vaccine doses available worldwide by the middle of this year. Theoretically enough to allow the rest of the world to start thinking past this pandemic too. Tom Clark, Sky News.